Enhanced Surgical Recovery, ESR, partnering with patients to improve outcomes. At HCA, we have been working on a new way to make the surgical experience better for our patients. Every year, 1.4 million patients have surgery in an HCA hospital or surgery center. The average patient stay in the hospital after a major surgery may be as much as 5 to 12 days, depending on how well you do after the surgery. New evidence, though, has shown that by making a few key changes, we can improve your surgical experience dramatically. So, you will be able to eat, walk, and go home sooner, and have less chance of surgical complications. Because we want to decrease the time away from your home and family and get you back to your normal activities as soon as possible, we developed Enhanced Surgical Recovery, or ESR. The ESR process includes preparing you before the surgery, reducing the stress on your body during surgery, and helping you feel better as soon as possible after surgery. It is important that you feel as healthy as possible before your operation and that you also play an active part in your recovery. During the Enhanced Surgical Recovery process, our staff will be there with you every step of the way, guiding and supporting you through 3 stages. 1. Pre-admission preparation. 2. Day of surgery. 3. Recovery. You can rest assured that at whatever stage you are in the journey, our team will be there with you, committed to providing you the best care possible. Stage 1. Pre-admission preparation. Once your surgery is scheduled, you will speak with a nurse about the details of your procedure. Depending on the type of surgery you are having, you may also be asked to come to the hospital to meet in person with a pre-admission nurse. The staff will walk you through the ESR process and tell you what to expect during your stay at the hospital. You are encouraged to read through the information provided and ask any questions that you may have. Remember, surgery is a very individual experience, and your journey and recovery may be different from others having the same procedure. Stage 2, the day of surgery. When you first arrive for surgery, we will check your personal details and answer any questions you may have. Please remember to bring your personal recovery checklist so you can track your recovery progress over the next few days. During your hospital stay, we will continue to check your personal details many times. Getting it right is not just important, it is crucial to the care we provide. We want to individualize your care as much as possible. It is quite normal to feel nervous throughout the experience, but don't forget that your comfort and safety is our top priority at all times. To settle those butterflies, ask as many questions as you need to. A highly skilled surgical team will work together with your surgeon and anesthesia provider to carry out your surgery using some of the safest and most advanced technology available. Stage 3, recovery. Once your surgery is complete, we will move you to our recovery room. Most patients don't remember this stage, but it is an important part of your journey with us. Here, the nursing staff will keep a close eye on you, using sophisticated monitoring equipment until you wake up. Once you are awake, and the nursing team and doctors are happy with your progress, you will be transferred to your room so you can start your recovery. During the early stage of your recovery, the nurse will continue to monitor you and make sure any issues like pain or discomfort are dealt with right away. Remember, it is important to take deep breaths and cough after you wake up to prevent any fluid buildup in your lungs. The nurses will help make sure you have the right amount of pain relief so you can perform these deep breathing exercises. The nurses will ask you to score your pain using a number from 0 to 10, 0 being no pain and 10 being the worst pain possible. We encourage you to notify your nurse when your pain level reaches a 3 or 4 so they can provide you adequate medication for pain relief in a timely manner. Always let your nurse know if you have too much pain or discomfort. It is important to start moving as soon as possible after your surgery. The nursing and physical therapy staff will help you get started. This is where your personal recovery checklist will come in handy. You will be encouraged to go for short walks to strengthen your body and get you back to the level of fitness you had before your surgery. Nutrition is also an important part of your recovery process. You'll be encouraged to drink water and possibly eat shortly after you wake up from your surgery. You will be ready to go home when 1. You are able to eat and drink. 2. Your pain is under control. 3. You are able to sit out of bed and walk around by yourself. And 4. You have had a bowel movement or have started passing gas. Then, the nursing staff will speak with you about how best to continue to look after yourself once you return home. This might include things like avoiding heavy lifting for a time and understanding that your recovery continues after your hospital stay. It is normal to feel a little tired or have less energy than before your surgery. This is just your body taking time to recover. Once all post-surgery steps are complete, your friend or relative can help you get home safely. The enhanced surgical recovery process will enable you to do this more quickly and more comfortably. We wish you well on your journey to recovery.